Good evening. Today, after a gap of 1 week, we have restarted this video series. Today's video will be on domestic violence and its effects on health of women and children. See, basically, as I am a psychiatrist, what I see in my clinic is, especially when we see women who are screened for depression, when we talk to them, what we realize is there is a very high incidence of domestic violence in their family. So in fact, this is a must that probably every psychiatric clinic, if we do a survey of domestic violence, probably we will know more about it. It's very sad that community is not aware about the consequences of uh, this particular menace, this domestic violence. In fact, I would say it's a public health problem. In fact, if you look at the correlates of domestic violence, you will see that a majority of this domestic violence occurs under the influence of alcohol or drugs. And of course, this creates a lot of health issues. So when it comes to women, they develop a lot of health issues like depression, anxiety, eating disorders, sleep disorders. They also develop guilt, shame, and in fact many women land up in a psychiatrist clinic because of what is called as post-traumatic stress disorder. It's also known to cause a lot of psychosomatic illnesses, also suicides, and of course unsafe sexual behaviors. Then what is not known is these women in fact start projecting their problems on their children, sometimes on their other relatives. And of course what is needed is, probably this is a very gender sensitive issue. What is needed to be understood is violence, the domestic violence, the majority of the persons who are affected are females. They are hit by males, they are hit, and sometimes it is not just hitting, it has got various correlates like physical, psychological, emotional, and hence we need to be very careful about this, and we need to educate the society on the problems this domestic violence can cause. Now coming to children, in fact it is very well known that children who are bred by violence, they themselves become violent. In fact, if you look at the problems of children, you can identify even in preschool. What happens is, children whose parents fight and where mother is being hit by father repeatedly, we see the incidence of thumb sucking, bedwetting, and sleep disorders are quite high in those children. And of course, as they go to school, there is school refusal, guilt, and these children do not have much friends. They refuse to make friends, and in the teenage they become truant. They escape from the school, they go out, they mix with friends, they indulge in risky sexual behaviors, they have very low self-esteem. In fact, what is noted is these things can cause a lot of long-term effects on children. In fact, what is noted is, these children, as I told you initially, they themselves become abusers. And in fact, depression, anxiety disorders, substance abuse is found to be high in children who have been hit by parents, or hit by or the children see their mothers being hit by fathers. So this is something which community should know, and in fact they have noticed that even certain physical diseases like diabetes, hypertension, obesity, heart disease, this is more in those children who had parents who were fighting among themselves and had uh, their mothers being hit. So basically what you should understand is there are long-term implications of domestic violence, and domestic violence needs to be addressed in a right way. In fact, when it comes to addressing domestic violence, it involves addressing the affected, that is the women, and also addressing the children. In both these things, what is important is, one is improving their self-esteem, improving their health, relationship skills, so that they develop healthy relationship skills. And in fact, we at the psychiatrist clinic, in fact the psychosocial consultants, they take a major role, talk to these patients, explain them regarding healthy relationships. And of course, many a times you will be surprised, psychiatrists will be forced to give like when the patients ask us for professional help, there are times when patients express that they want to dissolve the marriage, they want to go for a divorce. And usually a psychiatrist wouldn't recommend dissolution of marriage, but in these sort of abusive relationships where the child is suffering, where the mother is suffering, then many a times the psychiatrist has to be silent, or psychiatrist has to go with whatever the decision the mother takes. So basically this is something very painful for the psychiatrist. But still, psychiatrist will have to arrive at a safety plan. He has to see that the mother and child are not being hit. And in fact, many a times the role of psychiatrist or counselor, it becomes very difficult. In fact, there are instances where to arrive at a proper decision, we do take lot of time. But what happens is, especially when the relationships are abusive, and when it is affecting the morale of the child, and also affecting the person who is being regularly abused, and they are developing some psychological issues, so it becomes very difficult. And in fact, the role of community in these sort of things, the role of police, the role of the legal fraternity, the courts becomes very important. And also we need to sensitize the community in general, and also the professionals. Like many of these cases go unnoticed because the victims never speak out. In fact, they come to the medical casualty. If you look at the nature of injuries, you very clearly understand that these people have been hit by their relatives, but they do not speak about this. So basically what we need to do is, we need to sensitize the community, the doctors, the nurses, then the police, the lawyers, the judicial officers, a wide range of professionals need to be involved in preventing domestic violence. And I feel many psychiatric illnesses can be prevented if we address this issue of domestic violence. It is a major public health problem. So this is our initiative from One Good Step and Dr. A.V. Baliga Memorial Hospital to help the society, be aware of the common problems our people are facing, so that let us accept that these are our problems, let us analyze and take action. With this, I end this video, and I request you to please subscribe to our channel, and also please be interactive. You can always tell us what you want us to speak, and if you have any suggestions, we are welcome. Thanks for a patient listening.